Hello and welcome to Joan Comrie's Feeding Tips. My name is Joan Comrie, and today we're going to talk about a fairly emotionally charged topic called baby-led weaning. The information I'm going to provide for you today is going to come from the perspective of a medical professional that I am as a speech pathologist who's worked with infants and children with feeding issues for over 30 years. As a parent, it's very important when you decide what type of strategy or techniques you're going to use for feeding that you understand the risks and the benefits to those techniques as you make your decision about whether a certain technique or strategy is going to work well with your family or not. And as you know, every child is individual, so what works for some children may not work for others. And I want you to keep an open mind as we talk about the benefits and the risks of using the strategy of baby-led weaning, and use that information to make your decision about what you want to do. First of all, let's talk about the wonderful ideas of baby-led weaning. Baby-led weaning provides unstressed and very fun feeding opportunities for kids. That is awesome. I love the fact that they are having huge sensory opportunities for oral exploration as well as food exploration, as they're squishing up the food, as they're putting what they want in their mouth, as they're biting it and licking it. All of those type of strategies I use very frequently in my feeding therapy to help children create desire and fun, positive opportunities about feeding. Another thing that I love about baby-led weaning is that babies are brought to the table for mealtime, and that provides the child some great information and exposure to positive, healthy eating and family mealtime. That's great for kids. Ellen Satter is a nutritionist out of Madison, Wisconsin, and she wrote a book, This Child of Mine, Feeding with Love and Good Sense. And what I love about that resource, and have a lot of my families that I work with read that book, is that it talks about the division of responsibility. And what that means is that the parents are responsible for providing good-looking, healthy, skill-appropriate foods, and the child's responsibility is to decide how much they're going to eat, whether they're going to eat, and when they're going to eat it. And that, to me, is a very appropriate and very wonderful component of baby-led weaning. The other nice thing about baby-led weaning is that children are given whole foods, and they're not processed. And that is wonderful and a more healthy opportunity for children to have unprocessed foods. So let's talk about what some of the concerns that a medical professional may have about baby-led weaning. First of all, there's not a lot of literature on baby-led weaning, and there's tons of literature on typical feeding development. I was able to find 3 research articles or presentations on baby-led weaning, and 2 of them were case studies that demonstrated that children who used baby-led weaning have better variety of foods. And I would think that is an awesome result of using baby-led weaning. It's very important for our children to be comfortable with a good variety of foods. The concerning research that I read about baby-led weaning is that they looked at 600 parent and infant dyads, and those parents were using baby-led weaning, and 30% of those parents reported choking incidences with baby-led weaning. And that is very scary to me as a medical professional and as a mom. That is a high incidence of choking. And we know that under the age of 5, choking is in the top 5 of reasons for death in children under the age of 5. So choking is a very, very scary thing for parents and for medical professionals alike. The other thing that medical professionals have some concerns about baby-led weaning is that babies are eating a smaller volume of food. And if you think about food before 1 is for fun, but it also needs to be nutritious. So you still need to make sure that you get good levels of calcium, zinc, and iron. And some of the studies show that children that are following baby-led weaning tend to be a little deficit in those nutrients. So if you choose to do baby-led weaning, make sure that you find good levels of those essential nutrients in the food that you're providing for your child. And some of the concern also from a medical point of view is that the child's not getting enough calories from the food. And it's a lot easier to ensure that you have good calorically dense, nutritionally dense food when you're providing it in a puree state, because it's a lot easier for children to eat purees than it is to have to chew, especially in the younger ages. And so you also want to just make sure that you keep an eye on weight for your child if you're going to use baby-led weaning. As a speech pathologist, I have two very large concerns. First of all, baby-led weaning talks about learning to chew before you swallow, and that's a reason why the babies are gagging or choking. So for me as a speech pathologist, that is very concerning, because we know developmentally children are learning to swallow, then they learn a new skill. They learn how to manipulate during that skill. So let's say it's going to be chewing. So they learn how to chew and swallow simultaneously. It's not that, I think the reason that there's a higher incidence of gagging and choking in baby-led weaning is because children are given foods that are not skill appropriate. So they don't have good lateral transfer, they don't have good chew, and they put the foods in their mouth and they try to suck it. And using a suck pattern does not get good tongue tip, medial, and posterior tongue elevation to be able to swallow more thick or dense foods or pieces of food. And my concern is that if you're not providing skill-appropriate foods, a couple things are going to happen. You know, the worst would be a choking episode or a gagging that results in vomiting. And those are really scary for the parents, and they're really scary for children. And at some point, I'm going to talk more thoroughly about post-traumatic feeding disorder, which is when children have an episode of choking or gagging or vomiting that scares them to the point that they start having feeding aversion. So that is experiences that we never want our children to have. Another concern is that if a child doesn't have the correct skills, they're going to spit the food out. That's a positive thing. But if they figure out how to swallow it and over time slowly desensitize their gag, that they're able to get down larger pieces of food, that can be complicating to their GI system and maybe cause constipation, or you may see food in the bowel movement, which is never normal. And then also the concern is if the pieces are that large, your body does not have the ability to absorb the nutrients out of it. So those are a couple concerning things. The other thing is that you want to make sure that you've got that skill match that we just talked about. So making sure that your child has the ability to swallow and manipulate that food appropriately, because you're giving the right size foods. And just giving a smaller piece of food can make it worse, because it doesn't give you enough tactile information to stimulate you to do more of a chewing pattern. Okay, so let's talk about what you should do. So my suggestion to you is to maybe consider a combination of both of the different techniques. So take the awesome things about baby-led weaning, which is the great feeding experiences, the unstressed feeding exposure, a good variety of food, but also you need to make sure that your child has appropriate tongue transfer of the food and chewing skills. So you need to make sure that you match your food with your child's skill ability. And if you do a combination of those things, you will have a happy meal times and happy family meals. And that's really the importance, is making sure that your children are exposed to safe and fun and unstressed feeding experiences. I hope this was helpful. Please feel free to leave me comments and to share this with anyone that you think it might be helpful to. And good luck making your decision. You guys are great parents, which is a piece of why you're listening to these videos, so that you can learn more about the topic of feeding and making sure that you are doing everything that you can for your child to ensure the best oral motor patterns for feeding development and for speech development. And like I said, for happy, healthy meal times. Thanks.